Technology has certainly changed a lot of industries, right? Certainly the medical field being one of them. In fact, 60 years ago, the chairman of the American Medical Association put his predictions of how healthcare would evolve, if you will, into a time capsule. Joining us to talk about what he predicted and what came true, and maybe what didn't come true, is Dr. Sabrina Fabi. All right, Dr. Fabi, this one's a really interesting one, I bet, for you too.
Yeah.
So what did Dr. Lowry McDaniel predict, and how close was he, if you could say?
Well, he was really close in predicting that we would have better ways to treat eyesight, and so that we wouldn't lose our eyesight, usually with cataracts. And so we came across the cataract surgery that we now do, and so patients don't necessarily lose all of their eyesight with age because of this. So that he was right on. He was also right on in predicting that we would have better treatments for cholesterol and decreasing cholesterol. Are we there 100% yet? No, but we are much better. But he was a little off when he predicted that we were going to be living to 150 years of age. I don't think any of us want to live to 150 years, no matter how great we look of it because of the cosmetic procedures that we have. But he did predicted that hormone therapy would keep us looking younger. I think he didn't realize that we would have fillers, neuromodulators, and lasers and devices that would actually be doing it, not just hormone therapy.
Right. Here, Mr. McDaniel, here is the Botox that probably had not been invented.
Right.
He also predicted, I thought it was really interesting, that the common cold would be sort of a thing of the past, and clearly we still see that to this day. All right, let me ask you, Dr. Fabi, if you could put your predictions into a time capsule, what do you think would happen in the next 60 years? We're talking the year 2075.
I know, and so I predict that, like we were talking about last week, DNA testing is going to play a bigger role. Maybe not necessarily at home, but even if it's at home, we're not only going to be using it to predict what we're at risk for, but perhaps what diets would be best for us, what skincare regimen would do us better, and perhaps what medication we're going to be more responsive to. And I think the medication that we utilize is going to be probably more DNA targeted or gene therapy targeted.
Really interesting. What do you think is the area we're going to see that we will see the most advances in, and maybe that we've seen the most advances in even since this time capsule in the last 60 years or so?
Honestly, it's in the aesthetic arena, which he didn't even cover.
Yeah.
I think it's in these neuromodulators and fillers, because we recognize that, yes, they're smoothing out wrinkles and keeping us looking younger and more competitive in the workforce, but I think there's a component of how it affects our mood. Certain of our colleagues, like Steve and Diane and others, have published on the effects that they have on our mood and patients feeling better when they do it. So it's not just looking better, but it's feeling better. And I think that that's a prediction I have, as well as other colleagues, that it's also going to have a role in how patients feel and perhaps combating some of the anxiety and depression that we're seeing.
Yeah, which is actually good news for you, because that means more job security for you, right? As
exactly.
more of us try to look younger. Before I let you go, anything surprise you about Dr. McDaniel's predictions back in 1955?
Well, 5 years later, the first oral contraceptive pill was actually approved by the FDA. So I don't think he came close to talking about that. And then 1978, the first test tube baby was born. And so we've really come a long way also with just fertility. And those that have fertility problems actually have a greater hope now. And I think we're going to see more of that too.
Yeah, I mean, even look at how cell phones have changed, right? Like, it wasn't that long ago we had the huge cell phone that we walked around
like dragged
us
down. Yes.
Really, really interesting. Dr. Fabi, always great to have you on the show. Thanks.
Great seeing you, Jen.